Hi everyone, I'm Dr. Yang from Joint Shantou International Eye Center. Today's online lesson of ophthalmology is optic neuritis. The learning objective is to make the correct diagnosis and institute appropriate treatment for optic neuritis. First, let's see a case. A 23-year-old woman complained of decreased vision in her left eye for 2 days, pain with eye movements. Fundus examination revealed papillary edema and hyperemia. What's the diagnosis? What further tests are required? How to treat this patient? Hope you can answer these questions at the end of this section. So, what's optic neuritis? Optic neuritis is an inflammatory, infective, or demyelinating process affecting the optic nerve. According to the affecting site, it can be divided into papillitis and retrobulbar optic neuritis. Papillitis occurs within the eyeball, and retrobulbar optic neuritis occurs posterior to the eyeball. Optic neuritis occurs most frequently in patients between 20 to 45 years old. Women are more frequently affected than men. 20 to 40% patients with optic neuritis develop multiple sclerosis, MS. Etiology of optic neuritis includes inflammatory or infective factors, autoimmune disorders, and toxins. Inflammatory infective processes, including Lyme disease, malaria, syphilis, viruses. Autoimmune disorders including multiple sclerosis, MS, lupus erythematosus, polychondritis, regional enteritis, ulcerative colitis, nodular panarteritis, etc. In about 20% of cases, retrobulbar neuritis is an isolated early symptom of multiple sclerosis, MS. Toxins including methanol, lead, and chloramphenicol. The most common symptoms of optic neuritis are vision loss. This symptom usually occurs in one eye, ranging from a slight blurring or blind spot to complete blindness. It can last up to 2 weeks. Pain around the eyes. Eye movement can make it worse. Loss of color vision. Colors might appear less vivid than usual, while some people may be unable to distinguish between individual colors. Flashing or flickering lights. This symptom occurs with eye movement. Worsening vision. An increase in body temperature due to heat or exercise can cause this vision change. Typical signs of papillitis: edema and hyperemia of the optic disc. Blurred disc margin, bleeding around this margin will be present in some cases. Optic disc of retrobulbar optic neuritis looks normal. Investigations include afferent pupillary defect, red-green color impairment, and delay latency in VEP. On perimetry tests, typical central or pericentral scotoma will be seen. In the fluorescent fundus angiography examination, this linkage will be found. MRI suggests demyelination of optic nerve. This table shows the main differentiating features of optic neuritis and AION. The average onset age of AION is usually more than 50 years old and have a history of hypertension, diabetes, or cardiovascular disease. And that of optic neuritis is 33 years old. Patients with AION present with sudden painless visual loss, while patients with optic neuritis complain of impaired vision for hours to days, and with pain on eye movement. Visual examination shows inferior altitudinal defect in AION, but we find central scotoma in optic neuritis. In FFA, there is delayed disc filling in AION, but not in optic neuritis. treatment on optic neuritis depends on underlying disorders. For example, if it's caused by syphilis, we should treat with penicillin for the primary disease. In some cases, it normally improves on its own over several weeks or months. To help the patient heal faster, a high-dose steroid through an IV. This treatment may also lower your risk of other MS problems or delay its start if it's the cause. But while these drugs help the swelling go down, they won't make a difference in your vision. In special cases, there would be other treatments such as intravenous immunoglobulin, IVIG, also called plasma exchange. This is a medication made from blood. You get it through a vein in your arm. It's costly, but it may be an option if you have severe symptoms and can use steroids or they haven't helped you. You can get this treatment long-term if you have optic neuritis and your brain MRI shows you have lesions. Vitamin B12 shots. It's rare, but optic neuritis can happen when the body has too little of this nutrient. In these cases, extra vitamin B12 are needed. Most people recover their visual acuity without treatment over several weeks, once the inflammation in the optic nerve dies down. This tends to be the case when optic neuritis is not linked with another underlying condition. Full recovery can take longer. In some instances, it may take up to a year after the first symptoms appeared. Although visual sight may return to normal, some slight vision changes can remain. These changes include difficulty in telling specific colors apart or difficulty with depth perception. These are my references. Thank you for listening. See you next time.